The clinical manifestations of gonorrhea infections can be classified as local or systemic and uncomplicated or complicated. Uncomplicated local infections for men include urethral infections, and symptoms of those infections include painful urination, purulent penile discharge, and urethral pruritus. 5 to 10% of men are actually asymptomatic, however, and over time, 95% of these cases resolve spontaneously in men. In women, gonorrhea infections that are uncomplicated and local include urogenital infections. Some symptoms of that could be dysuria, increased vaginal discharge, abnormal menses, pelvic pain, and mucopurulent discharge from the cervical os. 50 or more than 50% of women are actually initially asymptomatic, and symptoms do not often occur until the infection has spread to the upper reproductive tract, which includes the uterus, fallopian tubes, and ovaries. Complicated local gonorrhea infections for men include prostatitis, epididymitis, and lymphangitis, and in women can include salpingitis, bartholinitis, and pelvic inflammatory disease, or PID. PID is an infection of the uterus, uterine tubes, and eventually the peritoneum. Symptoms could be chills, fever, nausea, vomiting, and pelvic pain, and it can actually result in infertility due to permanent damage to the ciliated epithelium in the fallopian tubes, which impairs the passage of sperm. And systemic gonorrhea infections would be disseminated gonococcal infection, or DGI. This is a life-threatening spread of the gonorrhea bacteria into the bloodstream. Symptoms include a generalized rash, severe joint pain, and possibly meningitis or endocarditis.